The lifted up apex, core and sabot, peasant's boot-shaped heart, due to the right ventricular hypertrophy, is seen well in this chest X-ray PA view. The right-sided aortic arch is seen indenting the tracheal air column on the right side. There is mild cardiomegaly and right atrial enlargement as well in this adult person with Tetralogy of Fallot and associated inferior wall myocardial infarction. The lung fields are oligemic due to the right ventricular outflow tract obstruction in Tetralogy of Fallot. Tetralogy of Fallot is the commonest cause of right aortic arch in an adult. Usually, the murmur originating from right ventricular outflow tract in Tetralogy of Fallot is short if there is severe cyanosis, as the flow across RVOT is less, as the blood gets preferentially shunted across the ventricular septal defect into the aorta. Long systolic murmur with severe cyanosis in Tetralogy of Fallot can occur with 1. TOF with absent pulmonary valve. 2. Restrictive VST. Long murmur due to tricuspid regurgitation as the right ventricular pressure may go suprasystemic. 3. AV canal defect. Long murmur due to AV wall regurgitation. Color Doppler echocardiogram in Tetralogy of Fallot. Parasternal long axis view shows ventricular septal defect and aortic override. RV right ventricle, IVS interventricular septum, AO aorta, AML anterior mitral leaflet, LV left ventricle, LA left atrium, VST ventricular septal defect. Right ventricular free wall is hypertrophied. Color flow mapping shows blue colored flow from the right ventricle across the ventricular septal defect into the overriding aorta. This is the right-left shunt characteristic of Tetralogy of Fallot. Another view had shown right ventricular outflow tract gradient suggestive of infundibular obstruction. Apical 5-chamber view in Tetralogy of Fallot demonstrating the subaortic ventricular septal defect with aortic override. 50% of the aorta is committed to the left ventricle, while the remaining half is committed to the right ventricle. The VST in Tetralogy of Fallot is a malalignment VST, which results from the malalignment of the ventricular septum with respect to the aorticopulmonary septum during embryonic development. The shift of the aorticopulmonary septum towards the pulmonary side produces both the ventricular septal defect and the narrowing of the right ventricular outflow tract. Van Praag and colleagues hypothesized that